Hello and welcome to Doc AT. In today's video, we're diving into the critical topic of shock. What it is, why it happens, its pathophysiology and classification. Let's break it down together. Shock is a critical medical condition that occurs when the circulatory system fails to adequately perfuse tissues, resulting in insufficient oxygen and nutrient delivery to sustain cellular metabolism, leads to cellular hypoxia and metabolic failure. If untreated, it can cause irreversible organ damage and death. Following is a comprehensive breakdown of the types of shock, including detailed pathophysiology, symptoms, diagnostics, and treatment. Definition: shock is a syndrome of acute circulatory failure characterized by hypotension, usually systolic blood pressure less than 90 millimeters of mercury or a 40 millimeters of mercury drop from baseline, hypoperfusion, e.g. lactic acidosis, oliguria, altered mental status, inadequate oxygen delivery and utilization at the cellular level. Pathophysiology of shock. The fundamental issue in shock is oxygen imbalance. Decreased oxygen delivery, due to low cardiac output, reduced blood oxygen content, or maldistribution of blood flow. Increased oxygen demand, secondary to stress, infection, or hypermetabolism. Impaired oxygen utilization, at the cellular level due to mitochondrial dysfunction. The progression involves 1. Initial stage. Subclinical hypoperfusion without obvious symptoms. Compensatory mechanisms maintain perfusion, e.g. tachycardia, vasoconstriction. 2. Compensatory stage. Activation of sympathetic nervous system and RAS. Redistribution of blood flow to vital organs, heart, brain. Clinical signs: tachycardia, cool extremities, reduced urine output. 3. Progressive stage. Compensatory mechanisms fail. Metabolic acidosis, cellular injury, and systemic inflammation. 4. Refractory stage. Irreversible damage with multiple organ dysfunction syndrome. High mortality. Classification of shock. Shock is classified into 5 main types based on the underlying mechanism. 1. Hypovolemic shock, loss of intravascular volume. 2. Cardiogenic shock, pump failure of the heart. 3. Distributive shock, vasodilation with maldistribution of blood flow. 4. Obstructive shock, mechanical obstruction to blood flow. 5. Mixed shock, overlap of multiple shock types. Thanks for watching Doc AT. Subscribe, like, and share.